I am joined today by none other than Rob Perez. Rob is an operating partner at the private equity firm General Atlantic. He is a founder as well of Life Science Cares and is well known to be a force of nature within the biotech community. Rob joined me on a panel where we discussed the importance of ethics in cell and gene therapy. And Rob, I'm delighted that you've come to visit us here at ARM Studios. Welcome.
Thank you for having me, Tim.
Well, listen, let's talk about that ethics panel. So, why to you are ethics important within biotechnology, within cell and gene therapy specifically? And what did you say on the panel today, and what are some of the things you heard?
Yeah, well, first of all, it was a great panel, and thanks to you and ARM for putting it on. As I said on the panel, we deal with extraordinarily complex issues for which there aren't always just one black and white answer, issues where there are lots of prevailing opinions. For me, ethics is a way to think about a moral compass, a way of kind of helping to sort through almost a framework for how to look at complex issues. It won't give you the answer, but it will provide somewhat of a moral compass on how to get to the answer. So I think what I heard today was a lot of discussion on how we might collectively look at these problems. It's not going to be easy. No one has one simple answer, but by having this dialogue, I do think it ends up giving us kind of a roadmap for how we might get there.
And maybe tell us a little bit more about General Atlantic and your role, General Atlantic's role within cell and gene therapy.
Sure. So General Atlantic is a growth equity firm. So we're not providing usually kind of seed capital for companies to get started, but once they do get started and they've had some success, we're helping them to grow and innovate. So General Atlantic is really proud to be able to be involved in innovation and funding innovation, both in terms of therapeutic companies, but also tools and services companies. We help to fund organizations that are building new cell and gene therapy therapeutics, but also, for example, we have an investment in Panther RX Rare, which is a rare disease specialty pharmacy doing great work with patients who are impacted by rare disease, and they're best in the world at providing that kind of service. So we support great innovative organizations, both on the therapeutic side as well as organizations that are serving the whole cell and gene therapy ecosystem.
Yeah, and Panther RX is a recent member of ARM, thanks to you, so we appreciate that.
Yeah, we're happy to be involved.
Yeah. All right, you're the founder of Life Science Cares. In full disclosure, I sat on the board of Life Science Cares for many years.
We miss you.
Yep, thanks to Rob. But many in cell and gene therapy may not be as familiar with Life Science Cares and the work that you do. Maybe take a moment and just share with us more about Life Science Cares.
Sure. Thank you for asking. So Life Science Cares is the life science community's way of impacting poverty in the major biopharma hubs in the U.S. So we have chapters in Boston, San Francisco, Philadelphia, San Diego, and New York City. And what we do is we aggregate resources, both human and financial, and we take those resources and deploy them through the best nonprofits fighting poverty in those areas. So we focus on areas of kind of basic human survival, so hunger, homelessness. We also have a huge effort towards education. And finally, we focus on nonprofits that do work on kind of breaking the cycle of poverty. One of the things that we do, for example, is we have an internship program that we offer. We've been running for a few years called Project On-Ramp, where for students who are Pell Grant eligible, that are all students impacted by poverty, we provide an opportunity for them to have their first paid internship. We had 300 students this past summer get their first paid internship in a life science company, and we have a plan to grow that to over 1,000 students over the next 4 years to get their first opportunity. We're really excited about it.
That's awesome. Congratulations on
Thank
that
you.
success. So maybe just sort of stepping back a little bit, one of the things we're asking people is why do you do what you do? And what do you sort of love about what you do? And you can answer that any way that resonates with you.
Yeah, honestly, I do what I do now, particularly on the philanthropy side, because of the words, "There but for the grace of God go I." So I feel like I'm very, very lucky, grew up in the inner city. There were a lot of people smarter than me, a lot of people who had more talent than me that didn't, for whatever reason, get the opportunity that I got. And I know that if I can help to provide access and provide opportunity for those who really have all the talent but just need a little help accessing our industry, then more people can kind of be here to help with innovation and ultimately help patients. So that's why I do what I do.